Today's patient is a 62-year-old Caucasian female that presents for 2 frenectomies. First frenectomy is between 8 and 9. She's been restored there, and it looks like the papilla is starting to pull away. This is a Cotlow class 3 labial frenectomy, lip frenectomy, and you can see at where the arrows are as the base. You can actually, if you watch the base, you can see as the revision is being made that the tissue releases. I'm using a light scalpel CO2 laser, and this is cutting with light. The tip never touches the patient. Here I'm assessing the amount of freedom I have after my initial incision. You can see I'm really not happy with it. I'm going to make a slight incision to the left and then to the right side laterally to give me a little bit more freedom. There is no bleeding. With the CO2 laser, it instantly cauterizes as you're making the revision. So I'll test it here and just make sure I have the release I want. And this has been a really nice release, so I'm happy with it. I'm going to move on down to the number 5 area where we're going to do our second frenectomy. You can see I'm checking and double checking. That's just partially because I'm OCD, and that's how most dentists are trained, to double check and recheck. Even with me touching the incision site, there's no bleeding. So our second frenectomy is over here in the area of number 5. You can see the tissue is very definitely pulling away here. She doesn't want the same thing to happen between 8 and 9, which is another one of the reasons why we went in that direction. You can see very definitely there's some tension that goes all the way up to the attached gingiva. So I'm going to make a real small incision here, and you can see the tissue below it just releases and lays flat. And so I'm going to go in here and make a couple of releasing incisions, make it a little wider laterally at one position. You still see that there's some tension there. It doesn't look like it's quite where I want it next to the injection site where I got her numb. Go slightly posterior here, and then slightly anterior. And now it's released even more. It doesn't really look like there's any tension pulling on that the attached gingiva. So I brought her in for a post-op visit to just see how healing was occurring, and you can see that this is within normal limits. It looks just like we left it pretty much, although more healing has taken place, obviously. And then go over here to the number 5 area and see how the tension is. And essentially, looks like there's a little bit of reattachment there, but it's certainly nowhere near what it was. And this is absolutely, I would consider this as a success. And I'm including the post-ops on here just because when I started doing this, I would see docs showing the surgeries that they were doing, but I could never find any post-op videos like, okay, what does it look like at the post-op visit 1 and post-op visit 2? So this is our second post-op check. You can see much more pink here, good incision, good healing. Still healing occurring here at the second post-op visit. Let's check our other site. So great healing has taken place here. You can see this looks a lot different than our pre-op video. A lot less tension, a lot less movement, and if it had looked like this originally, I probably wouldn't have treated the site to begin with. So great healing, and thank you for watching so much.